Welcome to Nurse's Ladder. I hope you all are fine. So today I'm going to talk about a special topic which is related to patient safety. This topic is medication errors. As you all know, medication is one of the important part of patient care. Administering a good medication while following all the 5 rights of patient's drug administration is one of the key aspects in keeping a patient safe. So, without wasting time, let's begin the topic. Medication error is an error which happens during a point of time when the physician prescribes a particular medicine or drug till the point the patient receives it. It can be turned into an adverse event, and more specifically a sentinel event when a patient is ultimately. What are the different types of medication errors? Medication error is broadly classified into 5. First is prescription error, second, intending error, third, dispensing error, fourth, administration error, and the 5th one is near miss. So let's study or learn one by one. The first one is prescription error. A prescription error is an error which occurs at the point of time when a physician prescribes a particular medication for a patient. There are certain factors which can contribute to the occurrence of this particular error. Incorrect drug selected for a particular patient in terms of its dose, indication, quantity, or sometimes even prescription of a contraindicated or banned drug. These are some of the factors which can contribute to this particular error. Other factors could be illegible handwriting. That means the handwriting is not visibly understood. Inaccurate medication history collection is also another contributing factor to a prescription error. When a patient gets admitted, it is important for a physician as well as a nurse to know what is the previous medication history of that particular patient so that medication reconciliation could be considered. Inappropriate use of decimal points is another factor which can contribute to prescription errors, like in case of trailing 0. Use of inappropriate medication abbreviations also can contribute to prescription errors. Not being aware about the list of LASA drugs or high-risk medications which are being listed according to the institutional policy also can contribute to a medication error, specifically prescription error. So I hope you got a very good idea about the list of prescription errors. Now let's see how can you reduce or prevent these errors. Taking a proper history of the previous medications taken by the patient, even from patient or from the patient's family members, can help a physician for proper medication reconciliation. Also, we need to know as a physician what are the patient's allergies specifically related to a drug or medication. Always take time to review the class of medications which are ordered and which are being used for a particular patient so that duplication or overdosing of a drug could be avoided. It would be best if we could introduce prescription typing system in a particular organization in order to prevent typing error while prescribing a drug. Most importantly, use of capital letters or bold letters while prescribing a drug can reduce prescription errors as well as all other types of errors which can cause harm for a particular type of medication error on which I am going to talk is intending error. An intending error is an error which happens when a nurse or a ward pharmacist intend a particular drug. This is usually done in an HMIS, that is Hospital Management Information System. Sometimes a medication also is intended through a manual intent where it is written in hand. So this type of error could be like wrong patient, wrong drug, wrong dose, and sometimes it can even be related to the strength of the drug which is ordered for a particular patient. Intending error could be reduced by double checking the contents which are being typed or which have been written in the intending type of medication error is dispatching or dispensing error. This is usually committed by a pharmacist. Dispatching error happens when a pharmacist tried to dispatch a particular drug which has been prescribed by a doctor and intended by a nurse or a ward pharmacist. Examples for dispensing error could be a drug which is wrongly dispatched to a correct patient, or a drug which is dispatched to a wrong patient, or a wrong dose or strength of the prescribed drug is dispatched. Sometimes a dispatching error can also happen when a pharmacist is not well aware about grouping of LASA drugs as well as their storage and how to segregate high risk or high alert medications from others. It is very important for a pharmacist to know how to make storage of high risk drugs and LASA drugs and how to properly label them and separate them from other drugs so that dispatching error could be avoided. Also, a pharmacist should also remember about certain medical abbreviations which are used commonly by the physicians while prescribing a particular drug. And pharmacists also must be well aware about certain banned drugs of the healthcare industry. One type of medication error which I am going to talk is administration error. This is an error which happens when a nurse wrongly administers a drug to a particular patient. This is one of the nursing quality indicators which have been measured in terms of patient safety. Most of the drug administration errors happens in terms of route of the drug, and the most common ones are intravenous route in terms of the drug preparation as well as its composition and proportion as well as its administration. Another one important factor which is contributing to administration error is patient identity. Many times some of the nurses forget to double check the patient identity with two identifiers, and which results in an administration error. Incorrect labeling or not labeling a drug, specifically when a drug is mixed in with an IV fluid, also can result in an administration error. Sometimes there is a chance of documenting a drug being administered when actually it is not being administered, can also count it as an administration error. More than everything, an administration error always happens when any of the 5 rights of drug administration is violated. That is, right patient, right drug, right dose, right route and right time, and more specifically right documentation is violated. It could obviously result in administration error, which is always could be committed by a nurse. The fifth error on which I'm going to talk is near miss. A near miss is a type of medication error which is identified at the point of time when a nurse is about to administer a particular drug and she identifies that it is a wrong drug in terms of its dose, its recipient, its route, its time, or the technique by which he or she was planning to administer the drug. Near miss has to be reported in terms of adverse event reporting, because this time it was a near miss, but in future it could result in an administration error. So we need to report always near misses so that it will not, in future, it will not cause or result in an administration error. So I hope, my dear friends, you have got a very good idea about all types of medication errors. What are they? How can we prevent or reduce medication errors so that we can keep our patient safe at their bedside? Thank you for watching. Take care. Bye.